So we know that heart failure is always underestimated as far as mortality goes. If you look at mortality of various cancers, it is evident that the heart failure comes on top of the 5-year mortality, be it the leukemia or Hodgkin lymphoma or breast cancer. The heart failure mortality at the end of 5 year is as high as 48%. And this is a progressive condition with high mortality. And as we know, the natural history of heart failure, there are waxing and waning pattern with each admission or hospitalization of these heart failure patient. And as a result, the functional quality of life goes down and the mortality goes up. And the attrition rate is at the end of 5 years as high as 50%. So that's the harsh truth. We must also appreciate that the heart failure has a high risk of death and hospitalization. 9 out of 10 patients of symptomatic heart failure, especially on the current standard of care, are presenting to us with some kind of symptoms of heart failure, be it dyspnea or fatigue or the swelling of the body. 1/3 of patients with HFrEF are at high risk of hospitalization and CV death, including those who appear very much stable. And these are the stable patients which are more prone to die suddenly, or rather presenting as a de novo heart failure. And in the last graph, if you see that with each hospitalization of heart failure, the survival keeps going down to 2.6 year in first heart failure hospitalization, to 1.8 year in the second, 1.5 in the third, eventually 1.3, and leading to death at the end. So the attrition rate of heart failure is very high. So it should never be underestimated and should come as a shock when a person is diagnosed to have HFrEF, just like in case of cancer. And therefore, we should try and use the most optimized therapies which are laid down for heart failure.